Medical misdiagnosis is essentially where a medical practitioner has got the diagnosis wrong. This may be, for example, due to a failure to adhere to normal diagnostic criteria, a failure to properly examine a patient, or to properly listen to the concerns that are being raised with that medical practitioner. Some of the commonly misdiagnosed conditions and illnesses include, surprisingly, a number of women's health issues such as endometriosis, polycystic ovarian syndrome. We also see misdiagnosis of cancer, which can obviously be quite serious if, for example, there's been a long delay in the diagnosis of the cancer. If you suspect that you've suffered a delay in diagnosis, then we'd always recommend speaking to a specialist medical negligence solicitor for advice. This is particularly so, for example, in the case of a cancer diagnosis where perhaps the diagnosis has become terminal as a result of the delay. The impact of receiving a late or misdiagnosis depends on the particular circumstances, but a late diagnosis can cause a period of prolonged pain and suffering. It can cause an exacerbation of the particular injury itself. On occasions, particularly with delayed diagnosis of cancer cases, the delay can be serious because it can mean that the cancer has become terminal, whereas previously it would have been treatable. When we're assessing compensation for a late or misdiagnosis, we have to look at what has been caused by the late or misdiagnosis. So we would look at any pain and suffering, a prolonged period of pain and suffering. We would also look at the particular injury and whether any other losses are perhaps consequent on that injury, such as loss of earnings or the need for private care. The time limits for bringing a claim for misdiagnosis are 3 years from the actual negligence, or alternatively 3 years from the knowledge of a significant injury for negligence. So with a case of misdiagnosis, typically the 3 years would start to run from the date on which the actual diagnosis is confirmed.